All right, thank you, Matt. Covering your health right now after a number of schools closed due to illness. Well, there are a lot of different ones circulating in East Tennessee. As we've been reporting, we saw our first school closings last week, and we're seeing additional ones this week, including, as we've reported, Knox County. But the schools that have been forced to close are seeing several different things that are keeping students and teachers at home. With us now to tell us more about what's going around is Dr. Eric Penniman, Executive Director, Medical Director for Summit Medical Group. I know you're busy. Thank you for coming in to clear all of this up for us.
My pleasure.
So first of all, what types of illnesses have you been seeing?
Really three main categories. Influenza that everybody's talking about, which causes the most severe illness, but we're seeing actually quite a few people with strep throat, as well as then the GI bug. A lot of people refer it to as the stomach flu. Yeah. It's really not an influenza virus. It's usually a norovirus, and lots of folks with nausea, vomiting, diarrhea, duration. So three separate illnesses that are kind of spreading throughout our community.
And all three make you just feel awful.
Yeah, really.
Oh, goodness.
Yeah.
So when it comes to deciding when to keep your kids home from school, what should parents be looking for?
Well, key number one is that if their child is sick, definitely keep them home. Because for our entire community, one of the best things that can happen is if the children are sick, if they stay at home, will prevent the spread throughout our community. The CDC says that if somebody doesn't have one of the chronic illnesses and you have influenza, it's good to call your doctor, but don't go to the doctor per se. Call in. You might be a good candidate for one of the antiviral medicines such as Tamiflu, but otherwise stay at home, treat the fever, get plenty of fluids, plenty of rest, and get well.
About how long are you seeing the recovery time take?
Influenza typically is a 7 to 10 day illness, so it's not a short illness. Strep throat, if a person's main symptoms are fever and an intense sore throat, probably a good idea to go in and get tested, because then you need antibiotics.
You've got to have that strep test to confirm
it. Yes, exactly.
So what does this tell you, if you're seeing a lot of flu cases right now, about the number of kids not getting flu shots, or is the flu shot not working?
So their surveillance the CDC does always tends to come out a little after the flu season. Last year there was a very good match, the flu vaccine to preventing the flu. Most of the cases we're seeing right now are influenza A, and it looks like it should be a good match for the flu shot. And so the moral of the story, the best way to prevent catching the flu and spreading the flu is to get a flu shot.
All right, and as always, wash your hands,
yes,
right?
Yes, cough into your sleeve and stay at home if you're sick.
Very good. Doctor, thank you so much.
You're welcome.
We really appreciate it. And we hope everybody who isn't feeling well right now gets better very soon. Bo?
Definitely. All right. Thank you, Lori. A kidnap